For more than 25 years, Aeris Family Dental has been taking excellent care of their patients in Tucson and southern Arizona and keeping up with the latest trends in dentistry. And Dr. Lan Allen is back again to tell us all about the practice. Dr. Allen, thanks so much for joining me again.
Thank you for having me back.
Nice to see you. So we might have heard at some point something called teeth in a day. What is that?
There's two types really of teeth in a day that are discussed and talked about a lot. The first is somebody that has dentures, that is totally missing teeth. And so there's advertisements out there that say, hey, you can get teeth in a day. And that's, while doable, there's also a lot that goes into it. I was kind of thinking an example would be, expecting food to just show up on your plate without preparing the grocery list, doing the shopping, doing the cooking. And so there's obviously some things that go into it. So that's the first thing that people talk about with teeth in a day.
So you're saying instant gratification isn't always the best option?
It's not. Like I said, it's very involved. In that kind of case, somebody has all their teeth missing and they're going to hold a denture with multiple implants. And so, number one, it's costly, but it does take some time to get to that point.
And what are the other types of teeth in a day?
The other kind is one that's like a single tooth crown that's made in the office. There's a milling unit, and by CAD CAM, we take pictures of the tooth. It's all digital. And then they form the tooth digitally, and then it's milled out of a block. And while convenient, sometimes you have to live with the other things that happen there. And actually, next time I come on, I want to do some demonstrations and get out a hammer and smash some teeth and kind of show you the differences and maybe why. That's not necessarily where I'm at right now. I'd rather deliver kind of a stronger, higher quality crown in that case, and so that it's meant to last.
Right, you want quality over speed is the idea, and I can't wait for you to come back and show us that little science experiment. It'll be a good time. So you don't do those crowns in the office is what you're saying?
No, I don't. Not that kind that are milled, no.
And when would someone need a crown versus a filling?
So a filling is good when it's kept in the size that it's supposed to be. A tooth can only support so much. Otherwise, that filling now becomes like a wedge, and it can almost drive the tooth apart and break. So somebody that needs a crown would be when that size is passed. I find it funny. I hated physics when I was taking it in school, but I find that I apply a lot of engineering and physics to what I do now. So a filling is narrow and small, whereas if it gets larger, a crown is really needed to really save the tooth.
Right, because I think many people may not realize, and I may be wrong about this too, is that when you do a filling, you actually chip away at part of the tooth and then add other material to kind of fill in the space.
You do, exactly, yeah. Yep, just like filling a crack in a sidewalk. I often use potholes in the roads. We can put a pothole fill, and we all know that it'll last for a little time, but ultimately, you really need to repave the road. Okay, got it. That makes sense. And then as far as veneers and bonding, what's the difference there? Bonding is taking that same filling material that we've been talking about and just kind of pasting it over the top of the tooth. Okay. I tell everybody it should be considered a temporary fix. Don't expect for more than a couple of years. It's going to chip, it's going to fade, it's going to discolor, and there's a chance to have decay. Whereas a veneer is taking really aesthetic, pretty porcelain material and putting them over the top of the teeth. Yeah. And veneer versus crown? That is really just comes down to the shape that you're trying to work with. It used to be that a veneer was one material, and it was the best looking. Things have changed. Now we can make a crown and a veneer out of the same material. So now it's great because we get to do whatever's needed for the tooth. Right. It's all about having a beautiful smile, and it takes time, it takes effort. What's the most difficult thing cosmetically that you think you do for a good smile? I would say the hardest thing is just working within the parameters that you have. We have a lot of times people come in and say, I really want to fix this, but I have a very small budget, or structurally their teeth might be in a position or a shape that that little fix is not going to do it. So it really works best for everybody to just get a consultation, find out what can be done, and just be realistic. That's the hardest thing that we do in dentistry, is one single tooth right in the front, because you're trying to match it to everything else there. Well, and you said a couple key words, and that's budget and being realistic. And your practice has something great, which I've never seen before. This easy is a cost estimator, and I know we have a little screenshot of it. Describe sort of how it works. It's a great tool. We've developed it just for patients. They can click on a procedure. They can add multiple procedures. If they have insurance, they can click on that if they don't. But what it does is we've designed it to kind of just spit out a fee, even if it's not exact. You're going to be pretty close. Yeah, you're going to be pretty close, and I think that's helpful for people.
Right, just one of the many things that separates Aeris Family Dental from many others. Again, like we mentioned last time, it's not a big corporate entity. It's really individual doctors that do their best to help people right here in our community. And it's that connection that's really going to make a difference for their smile and make them feel like they're part of that family and make them confident.
That's what we're hoping. The great thing is we all are kind of pulling in the same direction, and our main concern is doing what's right.
That's right. Dr. Allen, thank you so much.
Thank you for having me back.
See you. Bye-bye. Aeris Family Dental has 3 convenient locations right here in Tucson, and for more information, visit TucsonTeeth.com.